The Cannabis Conversation. A European perspective on the emerging legal cannabis industry.
Welcome to the Cannabis Conversation with Anuj Desai, where we explore the new legal cannabis industry by speaking to the professionals that are helping to shape it. Quick message from me to say Happy New Year to you all. I hope you all had a great break, full of rest, booze, presents, peaceful family discussions and everything else. I had a very restful one. I managed to dodge the plague that was been going around, so that was a bonus. So we're here at a new decade now, which will certainly be interesting for all things cannabis, as I can't see things not progressing even further this year. I've got some great guests lined up for the next few shows, but as always, I'm on the lookout for more, so please suggest if you have any suggestions. I've also got plans to develop the podcast a bit further, which I hope to talk about in the next couple of months as well. So exciting things. So we're going to kick off 2020 with Dr. Leon Barron. Leon is a GP in the UK, and he will talk a bit about the problems on the ground in getting patients access to medical cannabis. Enjoy.
Welcome, Leon.
Hi, Anuj. Thank you for having me.
No, pleasure. Thanks for coming over. So there's a lot to get into there, but I think it's a really good opportunity for some of the listeners to find out about the practical difficulties of, getting medical cannabis from your doctor. But before we kind of get onto a bit more about the detail, maybe it'd be good for you to sort of introduce yourself and a bit about your background and how you first got into medical cannabis.
Yeah, so I came across medical cannabis probably almost 2 years ago now, 18 months, 2 years ago, when there were some high-profile media cases. I followed closely the case of Alfie Dingley and Billy Caldwell and all the some of the children with epilepsy. And roughly at the same time, I also heard about a relative of mine in Israel who was actually seeing some pretty life-changing response to cannabis treatments. So I guess that kind of sparked an interest for me, and I started reading up on it. I had to find my own resources really online and go through PubMed and look through journals. And I came across the work of Meshulam and some of the early kind of pioneers, if you like. Mm-hmm. And I began to think a bit more about how this could perhaps change clinical practice, and that there was something in this plant, in this medicine, and that could actually help patients as well that I was treating. So that was really the process for me. It was just identifying something that resonated with me, and also I also met Mike Barnes, who you probably know. He's very well known in the cannabis space, and he was fundamental really in pushing for the law change, and his paper was really interesting, that kind of highlighted the evidence for cannabis, medical cannabis treatments. And through Mike, I got more involved with the Clinician Society, and also met some other kind of pioneers, if you like, in the UK, some of the early prescribers, and some of the people that are more active in the space.
Brilliant. Yeah, Professor Mike Barnes has been involved in a number of projects in this space, I think.
Yeah, absolutely.
Certainly on the medical side, of kind of leading light in the UK.
Yeah.
So that's great. Yeah, I mean, look, a lot of the guests I have on the show, often their first sort of interaction with cannabis, or the thing that gets them most interested, is often having a relative that has got some sort of disease or illness and has used cannabis as a treatment. So it's interesting. That's
absolutely
how you got in.
Yeah, and obviously as a GP, I don't only treat my immediate patients, but I often know their relatives and the wider family. So I do tend to get a good understanding of how a condition, an illness, affects not just that patient but the people around them as well. And I think this is where cannabis medicines potentially can be really effective forms of treatment for some people.
Yeah, brilliant. So yes, as a GP, you're at the front line. That's generally how most people interact with doctors when they need to. And obviously it's over a year now that the law changed in the UK to allow, or technically allow, medical cannabis. How many actual patients are you sort of experiencing on a weekly basis that are asking you about medical cannabis?
Yeah, so when the law changed, there was, I think, quite a bit of excitement, if you like, from the media, and patients' hopes were raised. So it's become certainly a topic of conversation between doctors and patients. I do encounter probably a couple of 2 or 3 a week people that are asking me about medical cannabis. Sometimes they may have already spoken to their specialists and been told that they're not going to be candidates, or that then it's not an option for them. And also, what I have noticed is, and also alongside this is a great interest in CBD products, over-the-counter products. So patients will sometimes ask whether, do you recommend this CBD, or will CBD help for this problem or this ailment? And it's just becoming a topic, if you like, it's being spoken about more frequently between patients and their doctors. Yeah. And I get more colleagues now that come to me, GP colleagues, right, saying, "Oh, I've met a patient recently who's asking me about cannabis. I don't really know much about it. Can they speak to you?" I think I touched upon this earlier, but unfortunately, due to the various guidelines and guidance from the Royal Colleges, that actually the reality is very few scripts are being issued, particularly in the NHS.
Yeah, I mean, you hear various numbers, but it's very low, isn't it?
Very low. Yeah.
And so if someone, to use a kind of example, if I was to come to you with a pain issue, let's say, and I inquired and I said, "Are you able to prescribe me medical cannabis?" What would be the kind of...
So the short answer would be no, I'm not, because I'm a GP. Yeah. So I'm sure you're fully aware that GPs aren't allowed to be primary prescribers. Yeah. By law, we're allowed to prescribe under a shared care arrangement, but I think it's very, very few GPs I think are actually doing that. So I can't issue a script for cannabis, which personally I find disappointing, because I think GPs are very well placed to prescribe cannabis. There's also the question of how appropriate is a cannabis script for someone suffering with pain. Mm-hmm. So there's various ways of looking at this. Some doctors would argue that cannabis is probably is safer than perhaps prescribing opioids. And there's, certainly I've come across doctors from overseas who would prefer to prescribe cannabinoids rather than opioids for pain. But certainly here in the UK, there is a view, even amongst some of the more liberal prescribers, if you like, or doctors that are more open to it, that a patient should really have tried conventional therapies first. Yeah. Not necessarily all of them and exhausted every single licensed prescription out there, but at least tried some of the more traditional medicines, if you like. Yeah. So non-steroidals, paracetamol, perhaps weaker opioids. Mm-hmm. But then when you start to get into the territory of adding in additional agents like some of the gabapentinoids, pregabalin, gabapentin, amitriptyline, some of these drugs are quite poorly tolerated. They come with side effects, and they're often not effective. So, I think to come back to your question, I think it would be difficult for you in the current climate to get a cannabis script. Obviously, it depends on the context of what the pain is or the problem, or what you've been through already. Yeah, I think that's really the key.
So if it's and it's a bit noddy, but on a practical level, if you aren't able to personally prescribe, what protocol is there or is there not? Okay, whereby you would think, okay, he's gone through all the standard things that I would prescribe him, and none of them have worked. Would you then have to refer me to a kind of specialist? Yeah. Who is capable of...
Yeah, exactly. So I guess first option would be to refer you to a pain specialist through the NHS, but the outcome of that could be a bit of an unknown. Yeah. I suspect most of the pain specialists, I think most of them are not too keen on prescribing cannabis at the moment because they lack the knowledge and perhaps the education. But then saying that, I think there are a few coming through now who would be happy to prescribe. The difficulty would be that through the trust that they're working in, the NHS trust, it's then whether that script would get approved and signed off. Right. Right. So obviously then your other option is to go down a private route, and you're going to have more options in that respect. But the price of the costs are very high. Yeah. So that's obviously not an option for many people.
So I guess, to summarise, the NHS route is kind of reliant on the GP in the first place.
Yeah.
Being open to referring you to a kind of a consultant or whatever the term for the person that can prescribe you.
That's right.
But again, it would be an open-ended thing, i.e. current medication isn't working, see a specialist, and one of the possible things that the specialist could prescribe is cannabis, if they were minded to and it got sorted.
Exactly. So you may find one specialist is particularly open to it and they'll push your case forward and they'll try to do whatever they can. You may see a different pain specialist who is completely against prescribing and doesn't really want to hear about it. So that's the difficulty. And, and that, I think that's why we've seen the emergence of a private sector. I think NICE guidelines also, because they are really quite restrictive in what can be prescribed, that actually the doctors like to follow guidelines, particularly if they're working in the NHS. So I think actually the reality is it's really hard to get scripts through the NHS at the moment. Yeah,
I mean, it sounds like there's several hurdles compounded by just a general lack of knowledge in the area.
Yeah, absolutely. I mean, the other potential pathway for a patient would be something along the lines of the 2021 trial.
Yeah. So do you mind just filling in the listeners on?
Yeah, so this is an initiative that's being run by Drug Science, headed up by Professor David Nutt, who's very well known. He's a psychiatrist, very well known traditionally in kind of the drug space, really, and recreational drugs and
former head of the misuse of drugs.
That's right, yeah. So the 2021 trial is recruiting 20,000 patients, I believe, and they are open to a number of different conditions that they'll see and treat, and they will be collecting data, observational, longitudinal data, and following patients up. And I think, it's a fantastic initiative, and it will hopefully get people seen by specialists and scripts issued. So although it's going to be a slow process initially, hopefully, certain patients will get seen and treated and will add to the evidence base, which is obviously what, we like to talk about a lot in medicine and prescribing. So that's a really interesting project, and hopefully will enable some access for patients.
Yes.
Obviously there's still a long way to go in my opinion, but it's certainly a good start.
Yeah, great. I mean, the thing that I hear often from doctors is, the doctors I speak to tend to be like yourself, obviously, who have taken an interest in this area, and they lament the fact that the wider doctor population is, for good reason, and through just that's how it has evolved, but are very wedded to sort of clinical trials as the barometer for evidence, and that cannabis doesn't lend itself very well to that necessarily, or the length of time it takes to get those things is going to be quite a while. Meanwhile, patients are suffering.
Exactly. I think that's the key to it, is that the reality is some patients are suffering and they're struggling, and we do traditionally have very strict guidelines. NICE guidelines tend to look at randomised controlled trials, and for good reasons drugs go through the process of licensing, and they need approval by the MHRA, and then doctors will tend to feel, they will feel more comfortable prescribing licensed medicines. So cannabis has kind of come along and turned everything on its head in a way, in that patients know a lot about it. Often they do. Some of them might be using it anyway, and if you like, we're trying to fit this into a system that is kind of already quite established. Yeah. It's been established now, this way of practicing medicine for many, many years. And I think in order to kind of get the doctor on your side, really, or to be open to prescribing, it takes a bit of a shift of mindset and to kind of think a little bit more, think in a slightly different way in terms of how you prescribe and, the types of products you can give patients, and how it fits into the other kind of treatments. And so.
Yeah, I mean, I've talked about it a few times before. It kind of feels like it almost needs it's a paradigm shift, really, isn't it? Because it's a new way of evaluating medicine that isn't solely reliant on RCTs.
Exactly.
And I mean, are there any other parallels, or are there any other examples of types of medicines that whereby patient data is used as evidence as opposed to clinical trials?
I can't give you any specifics, although I know that there are a number of medicines that have been approved that are licensed and they've not been through RCTs.
Right.
There are a number. Okay. And it's also worth remembering that we prescribe unlicensed medications all the time as GPs.
Right.
So to give you an example, say a patient suffering with fibromyalgia, so duloxetine, I believe, has not been licensed for fibromyalgia, but it's often used as an add-on treatment. A lot of the paediatric dosing are unlicensed, so a lot of paediatric medicines haven't been through traditional clinical trials.
And just to clarify, license means licensed by the MHRA?
Yeah, so it just means that there's perhaps less of a responsibility on the prescriber because the medicine's been through strict clinical trials. There's lots of safety data. The prescriber is kind of given the dose and the specific condition that it can be prescribed for. So if you like, you've kind of got a really good backup if there was a problem with that prescription or a problem with the patient. So if a medicine's unlicensed, essentially it means it hasn't been through that same process, but that doesn't mean it can't be prescribed. It just means there's a bit more responsibility placed on the prescriber.
And is it ultimately your discretion as the prescriber?
Yeah, exactly. So, it is the discretion of the prescriber. So when cannabis was moved to a Schedule 2 drug, essentially you will be prescribing that off license if you're prescribing a whole plant product. And that's where I think there are some barriers to prescribing because some doctors will feel uneasy about prescribing unlicensed products. But like I said before, we do prescribe a lot of drugs off license.
Okay.
There's quite a few examples where
there's precedents for...
Yeah, like benzodiazepines, for example, are only licensed for short-term use for anxiety or insomnia. But there are so many people, particularly the elderly population, that have been on benzos for years and years, and no one's taken them off them or done a proper medication review. Clopidogrel, which is used for TIAs, that's become standard practice now, but that's an unlicensed medicine. It's not been through clinical trials, but it's used widely for certain things. So there are quite a few examples, and it's just not, in my view, an excuse not to be prescribing cannabis. If you know that it comes from a high quality licensed producer, it's been lab tested, you can see a breakdown of the THC and CBD ratios and other constituents. I think we know it's safe to prescribe.
Well, we know, you and I.
Yeah, exactly.
But it sounds like, I mean, again, it's something we've talked about before. Yeah. It sounds like ignorance for understandable reasons, but as not understanding that system, but not being a doctor, I would assume that you approach it in relation to an unlicensed medicine by looking at what the potential risks are, right?
Absolutely.
And I think it's well documented for those that know that the risks attributed to cannabis are very low. I'm not saying it's the same as, smoking street skunk 24 hours a day.
Exactly,
there are very obvious risks there, but I'm talking about it in a kind of medical prescription setting. The downside risks are low from everything that I've read.
That's my view on it as well, that actually the medicines that are commonly being prescribed in general practice, some of them are very dangerous and very risky. So I remember a few years ago, perhaps more so in some of my hospital placements, but oxycodone, OxyContin became very popular. We know now it's a very dangerous drug. It's pretty much, the US is in the grip of an epidemic at the moment of opioid prescribing, and some of these synthetic opioids are really some of them are very nasty, dangerous drugs, and a lot of them are commonly prescribed. So tramadol I've seen over the last few years, has become a common sort of third line agent if some pain's poorly controlled. Pregabalin or gabapentin, amitriptyline. And sometimes the combination of mixing those types of medications together can also be very risky. So one issue with the gabapentinoids, so drugs such as pregabalin and gabapentin, they've actually there's a high street value now to some of these medications. If people mix them with other recreational drugs, they can get a buzz off them. So I just think there are things that we are doing in our daily practice that is actually suboptimal, and we're not necessarily serving our patients in their best interests.
Yeah, that's absolutely the impression that I get, in that people say, "Oh, we don't know enough about cannabis or whatever." Yet we operate in a system where we're comfortable with prescribing things we know have very bad side effects.
No, that's it, and it's become.
We now, you've just mentioned that we happily prescribe unlicensed medicines. So
we do prescribe
medicines that don't reach the same bar that people are trying to put on this.
Yeah, exactly. And the prescribing habits over the years in primary care, I think, have become, certain drugs have just become accepted treatments, and often patients are on some of these medicines for long periods of time, and they might not necessarily get regular medication reviews, or often because of the time constraints in GP appointments, it's very hard to kind of do a proper medication review, or to get people reducing their opioid dosing, or trying different types of medications. So, I think I see a lot of the perhaps problems in primary care, and I can just personally see a place that cannabis could I can see it could fit in somewhere to the current system. I don't think it should necessarily be given to everyone and to all conditions, but I do think most GPs will be able to highlight a handful of patients that have really kind of exhausted every type of treatment pathway, and they're really struggling.
So this is a brilliant segue, I think, into the. It sounds like the education, doctor education, is very, very important, and maybe this feeds in nicely to what you're doing in some of the groups you're involved in. What would you mind talking a bit more about that?
Yeah, so I'm involved with the UK Medical Clinicians Society, and that's a group of doctors. So we've got Professor Mike Barnes, who's chair of the society, Danny Gordon, Dr. Danny from Canada. She's been fantastic with kind of educating lots of UK doctors and bringing her knowledge over from Canada. We've got a number of different specialists on the executive committee. So Dr. Liz Iveson, she's regularly prescribing cannabis scripts now, and Ellie Okiri and Rebecca Moore, she's a psychiatrist. And we've started to put on educational events. So we had an event last week in central London, which was very well attended. And the outcome from the day of teaching was that there were a good number, I think about 15 doctors who are happy to go off and prescribe for their patients. So that's a really great start, really well received. And we're bringing in lots of interesting speakers, and patients can tell their stories. And it's a great platform, really. I mean, the other thing that we have within the for members is a portal where people can discuss cases. They can talk about anonymised data, but we can talk about case studies and dosing and drug interactions, or problems that people are having with scripts, and from a practical sense, like how do I obtain the script, or who do I go to for this, and just a wide range of questions, really. How do I change this dose, or what do I do with this person? And so that's a really useful tool for doctors, and it's also open to other healthcare professionals and medical students. So no, that's fantastic. Actually, it's really exciting to be involved.
Yeah, that's
in that space.
Brilliant.
Yeah,
anything that's sort of kind of socialising education around this, I think it's brilliant. Medicine, like everything, is you're dealing with humans, so it's very hard to predict things. Great that you've got a forum where you can sort of discuss.
Yeah, it's fantastic. Things. It's great, and it's just focused on education and academic research. So we've got a nice section for like a database. So really like key papers for certain conditions and big studies, and it's really useful, and it's growing all the time. So we're getting new members signing up week by week.
Brilliant,
fantastic,
brilliant. And the Primary Care Cannabis Network.
So that's something I've set up myself, primarily to get GPs together. So I've noticed that most colleagues I work with don't know anything about cannabis, medical cannabis, CBD products, the whole spectrum, really, this whole field of medicine. So I've put that together myself, and with the aim really of bringing GPs together to learn, to discuss cases, to open up debate, and ultimately to provide a voice for GPs who want to sort of get into this space. I mean, ultimately, I'd love to see GPs as prescribers, and that would then put us on a level playing field with most of the rest of the world who have legalized it for medical use.
Yeah.
So if you go across to Holland or Germany or Luxembourg or where else, Israel, Canada, GPs are prescribing for a number of good reasons.
Yeah.
So that, I think that would be fantastic if GPs could prescribe. Even in Jersey, when the law changed last year, GPs were allowed to be prescribers.
Yeah.
From my understanding, none of them have yet prescribed because they were waiting for the NICE guidelines.
Right.
So by law, they could prescribe.
Yeah. Yeah. So, I mean, I another good segue, because we'll talk about NICE in a second. But yeah, I understand that. I mean, NICE is very well respected across the world, but is errs on the side of conservative kind of approach.
And don't forget that NICE will always look at things through the eyes of the NHS and also from a cost-effective angle.
Okay, yeah. So in relation to NICE, would you mind just letting everyone know what the update on the guidelines was and your view on the impact? Yeah,
so NICE approved a couple of medications, Epidiolex, which is a pure CBD product. It's a licensed product. They approved that for 2 quite rare types of epilepsy. They also approved for wider access to Sativex for spasticity and MS. However, they didn't really shift on their approach to cannabis for pain unless it's part of a clinical trial.
So, which is why my example before wasn't a good one.
Exactly. So NICE have not really kind of approved the use of cannabis and whole plant extracts for pain. Mm-hmm. They have approved Nabilone for nausea and vomiting and chemotherapy, but that's a synthetic cannabis product. So the reality with NICE is that access still remains quite limited for most people.
Do you see this as the very, very thin end of the wedge? Is it just a slight opening of the door? Or, I mean, clearly there's a lot of work to do, but...
I don't think it's really... I don't really see it as progress, personally.
Right. Okay.
I think if they want to wait for data and randomised controlled trials, then we're going to be waiting years and years for that to come through. So I would love to see a system that is open to compassionate prescribing, like they're doing in Denmark and Germany and throughout Europe and many other countries, where the discretion is kind of down to the doctor who's managing that person and they understand them well. And alongside that is this idea that the patient has choice. So there's a big emphasis. If you go through medical school and GP training, there's a huge amount of focus on patient choice and patient-centered care. Give patients the options of, deciding on treatments and what works for them. And I think this is an area that could really work well with that, in that, if someone understands what they're going to be prescribed and that maybe there's a lack of evidence, that there might be a slight lack of evidence for a particular, we don't have the randomised trials and so on, but they've tried other things, then that's kind of an informed choice that they could make about their own treatment. So I just think that in the short to medium term that we should allow doctors to prescribe on a compassionate basis.
Yeah.
End of life care, patients that we see at home and who are under palliative care teams, and I just think if it improves quality of life, then that's why I became a doctor. That's why I got into medicine.
Yeah. So 100%. Again, it sounds like just a lack of awareness of what cannabis potentially could do.
Yeah.
And also probably an undue focus on risk and maybe not a full awareness of risks.
Yeah.
Probably still thinking that cannabis is a bad thing.
Yeah, exactly.
And
don't forget, people are using it already. So I'm sure you've spoken about this in the past, but there's more data coming through that's showing how prevalent cannabis use is. And there was a recent study a couple of weeks ago where they identified, I think, 1.4 million people that are using cannabis for medical reasons. So even if it was just to take to serve that kind of cohort of patients, whilst we kind of get more data and more evidence and so on, then that to me can only be a good thing, to kind of remove it out of the hands of the the illicit market. Exactly. Yeah,
for sure.
You know, I mean, I get people phoning me up, or relatives, because they know that I'm interested in cannabis and I've got some knowledge in it, who are desperate for help. You know, I've got a family friend, and his daughter has MS, and she can't get a cannabis script through her specialist or any of her doctors that she's seen. And, you know, they're trying to find products online, homemade tinctures and things like that. And I think it's tragic that people are having to are being forced to access the black market when they're desperate. Some of these people are desperate for anything to help. So, you know, that's a reality.
Yeah, it's a crazy situation, isn't it?
Yeah, it is.
But hopefully, you know, with different parts of the world sort of accelerating at different paces, there'll be just a load more anecdotal evidence whilst we're gathering this other evidence.
Yeah, exactly.
It's just, if you're in pain or you're suffering right now, this is of small consolation, really, I think.
Exactly.
Cool. Well, thank you, Leon. I'm just going to end with my traditional question, which is, what did your parents say when you told them you were specialising in cannabis?
So, okay, that's an interesting question. Actually, my dad passed away a few years ago. He had Parkinson's. He was diagnosed at a young age, and he suffered really badly. A lot of medicines didn't work well for him. So unfortunately, he's not seen any of this work that I'm involved in. I would like to think that he would be very pro cannabis, medical cannabis. And he was a scientist, an innovator, a forward thinker. And yeah, I would like to think he was proud of what I was doing and interested in it. My mom is always kind of open. She's very forward thinking. She's always proud of anything I'm doing and interested. So she thinks it's really, really great and really interesting, as do a lot of my wider family and friends. And I think when you it doesn't take much, but just basic education and removing the stigma of the plant and the history of, you know, what we've kind of all grown up with, then actually you realise it can change lives and really help people. Yeah. So yeah, overall really good, really positive.
Brilliant. And I think you summed it up really well. All of the things that you're involved with, particularly around the Primary Care Cannabis Network, as the first port of call, sort of increasing the level of education for GPs and awareness and removing stigma is a really, really important piece.
Yeah.
So thank you, Leon, for that.
Thank you,
and
Nish.
also,
It's been a pleasure.
Thank you for joining me.
Lovely, thank you.
Cheers.